Hi, and welcome back to Health Nest. Did you know that up to 80% of strokes can be prevented? That's right. The American Stroke Association has recently disclosed that early recognition of symptoms and taking prompt action can prevent the occurrence of stroke in many cases. In today's video, we're going to reveal 7 crucial warning signs to look out for when it comes to identifying a stroke. We'll also discuss treatment. So make sure you stick around till the end. Timely intervention can truly save lives and prevent long-term disability. So pay close attention to these signs and act on them fast. But before we get into it, kindly take a moment to like this video and subscribe if you haven't already. Are you ready now? Let's get started. First, let's talk about stroke. Stroke, also known as cerebrovascular accident, CVA, is a medical emergency that occurs when blood flow to a part of the brain is interrupted or reduced, depriving brain tissue of oxygen and nutrients. This can result in brain damage and various neurological impairments, such as paralysis, speech difficulties, or cognitive problems. Now, let's find out what the 7 warning stroke signs are. 1. Sudden weakness in the face, arm, or leg. Imagine going about your day when suddenly, without warning, you feel a sudden weakness or numbness in your face, arm, or leg. This can be a frightening experience, but it's also a crucial warning sign that your body may be close to having a stroke. When one side of your body suddenly becomes weak or unresponsive, it could indicate that blood flow to your brain is compromised. One test you can perform is to try smiling or raising both arms above your head. If one side of your face droops, or if one of your arms drops involuntarily, it could indicate a stroke. This symptom demands immediate attention because acting fast can make all the difference in minimizing the potential damage caused by a stroke. 2. Sudden mental confusion or difficulty speaking or understanding. Your brain is the control center of your body, responsible for processing thoughts, understanding language, and coordinating movements. When your mind suddenly becomes cloudy, or you find yourself struggling to speak or understand others, it's a sign that something serious might be happening. Mental confusion, difficulty forming coherent sentences, or slurred speech can all be warning signs of stroke. These cognitive changes often occur suddenly and without warning, which is why it's crucial not to ignore them. If you or someone you know experiences these symptoms, seek medical attention immediately. Time is of the essence when it comes to preventing the potentially devastating effects of a stroke. 3. Vision problems. Your eyes are your windows to the world, allowing you to see and interact with your surroundings. So, when your vision suddenly becomes blurry, double, or even non-existent, it's a cause for concern. Vision problems can be a warning sign of stroke, as changes in blood flow to the brain can affect your ability to see clearly. Pay attention to signs like difficulty following objects with your eyes. Another indication might be suddenly seeing spots or experiencing double vision. If you experience sudden changes in your vision, such as a loss of vision in one or both eyes, it's crucial to take action immediately. 4. Difficulty walking, dizziness, loss of balance, or coordination. Your ability to move and maintain balance is controlled by a complex interplay of signals between your brain, nerves, and muscles. When a stroke is near, these signals can become disrupted, leading to difficulties with walking, dizziness, loss of balance, or coordination. You might suddenly feel unsteady on your feet, struggle to maintain your balance, or find it challenging to walk in a straight line. These symptoms can be alarming and should never be ignored, as they could indicate that a stroke is imminent. If you experience any of these difficulties, especially if they occur suddenly and without explanation, seek medical attention promptly. Enjoying the video? Show your support by smashing the like button, dropping a comment, and subscribing to the channel to become part of our growing community and never miss a new upload. 5. Severe headache with no apparent cause. While headaches are common and usually harmless, a severe headache that comes on suddenly and without any apparent cause can be a sign of something more serious, such as a stroke. The headache associated with a stroke occurs due to increased pressure inside the skull caused by bleeding or blockage in the brain. The bleeding irritates brain tissue or its linings, resulting in a severe headache. This type of headache is often described as the worst headache of your life and may be accompanied by other symptoms such as nausea, vomiting, or sensitivity to light. Ignoring this warning sign could put your health and well-being at risk, so don't hesitate to get help. 6. Unexplained fatigue. Feeling tired or fatigued is a common complaint, especially in today's fast-paced world. However, if you find yourself experiencing unexplained fatigue that doesn't improve with rest or sleep, it could be a warning sign of an underlying health issue, including a stroke. Fatigue can result from changes in blood flow to the brain or disruptions in brain function, both of which can occur during a stroke. So, if you notice that you're feeling unusually tired or sluggish, especially if it's accompanied by other symptoms on this list, it's essential to take it seriously. Don't dismiss persistent fatigue as just being tired. Listen to your body and prioritize your health. 7. Sudden changes in behavior or confusion. Your brain controls not only your physical actions, but also your thoughts, emotions, and behaviors. When your behavior suddenly changes or you feel confused and disoriented, it could be a sign that something is wrong. These sudden changes in behavior or confusion can be warning signs of stroke, as disruptions in brain function can manifest in various ways. You might suddenly act out of character, become unusually forgetful, or struggle to understand what's happening around you. These symptoms should never be ignored, as they could indicate a serious medical emergency. If you or someone you know experiences sudden changes in behavior or confusion, seek immediate medical attention to determine the cause and prevent further complications. Now that we've discussed the warning signs of stroke, it's essential to talk about treatment options. A common method of treatment is the administration of tissue plasminogen activator, TPA. TPA is a medication used to treat ischemic strokes by dissolving blood clots that block brain blood flow. An ischemic stroke occurs when a blood clot blocks a blood vessel in the brain, leading to a lack of oxygen and nutrients to that part of the brain. Patients receive TPA within 3 hours from the start of a stroke, administered by qualified medical professionals in hospitals. While this treatment can be life-saving, it's not suitable for individuals with certain medical conditions. Therefore, careful patient assessment is necessary before its administration. And that concludes today's video. Thank you for watching. Make sure to leave a thumbs up and subscribe to the channel. Also, check these videos out.